My name is Cassandra Morris. I'm a registered nurse at Springs Memorial ER, and I've been in that position for approximately 3 years.
If you could summarize your image of nursing into one word, what would that one word be?
Competency. You have to make sure that you can pick up on changes that the patient is having. You're going to spend more time with the patient than anyone else they come in contact with, whether you're in a hospital setting, doctor's office, whatever it may be. And you're going to be the one that's having to provide education to the patient. You're going to have to provide change of status. I know you guys have probably talked about SBAR. You're going to be able to say, hey, this is what they come in with, this is how they have changed, what are we going to do about it? At the same time, it's always good to know the recommendations of what you're going to, know, what are you going to do about it? Don't overstep your boundaries though.
How do you feel your job makes a difference?
You're saving lives, you're educating patients, you're able to relate things to them and teach them things that maybe someone else, maybe, of course the doctor knows about as well, but they just don't have that time. You're able to do bedside nursing. It's very rewarding for them to say, no one's ever been able to explain it to me. I've never been able to understand it, and now I do.
If you could pick another specialty within nursing, what would you choose?
Teaching, which is what I'm going back to school for right now.
What do you enjoy most about your job?
Why does this one get me every time? I like working 12 days out of a month. It's a great career choice because it gives you time to spend with your family and to do other things other than work Monday through Friday, 9 to 5. However, there are some positions, in the nursing field where that's what you work. But for me personally, I like that I feel plenty of time off to have a life and a career at the same time, and making a difference. I don't care if it's giving somebody a hug because they just lost a loved one, high-fiving a patient who has been drug-free, for 6 weeks, whatever it is, just knowing that one little thing you said either taught them or made a difference in their life to where they want to improve their health so you don't see them again.
What is the most difficult aspect of your job?
The 12-hour shifts, the nurse-to-patient ratio, especially with dealing with critical patients, not getting to eat, not getting to use the restroom.
How is your schedule as an ER nurse, and what do you like about it?
I work 3 12-hour shifts a week. I do Baylor, which is night weekend. It's with the exception of Saturday. I do Friday and Sunday night, and I do one weekday. And there are many choices. You can do different hours, different days. With most organizations, especially in a hospital setting, as long as you get a certain quota, you're good.
Okay. What is the benefit of choosing nursing over any other career in the medical field?
It allows for growth. You can remain a registered nurse and just keep up with your credentials, or you can become a nurse educator. You can become a family nurse practitioner. You can specialize and hold, a conference and teach other nurses. You can work with home health. Once you've gotten about a year or so under your belt, the offers will start coming in, and it is such a hodgepodge and such a variety of different things that you can do. You just have to find your niche of what you enjoy getting up and going to do every morning.
Do you have any recommendations for future nurses?
Yes. Mine totally just went blank. Good shoes. I think that's one that we had talked about. You definitely need to have good shoes. You need to take care of yourself so you can not only take care of your family, but you can perform your job. And it's really hard to take care of patients when you yourself, you don't feel good or you haven't had an adequate amount of sleep. Keep your books, all of your basic books. The ones that I have used the most would be Med-Surg, my OB and my Peds book, my drug book, and my lab book. And especially like with the drug book, sometimes, new drugs are added or things change, but for the most part, the human body's going to, remain the same. And, there's going to be, especially in that first year or two, there's going to be so many things you come in contact with that you're like, man, I really remember that. I remember hearing it, but I don't know anything else about it. That's it. And it makes you a better nurse. It helps you earn respect, which is definitely something you want with the people around you, especially you want to build that relationship with the physicians that you work with, so they know they can come to you and they can trust you.
Thank you.
Thank you.